Hi, good morning, everyone. Good afternoon if you're in Toronto or further east, like I am. Welcome to our canoe webinar, Extreme Heat, Forest Fires, and the Role of the Built Environment. My name is Alan McKee. I'm Communications Lead for Canoe, which is the Canadian Urban Environmental Health Research Consortium. We're going to get started in just a few minutes, but I'd like to take this opportunity to remind you to please turn your cameras off and stay on mute during the webinar. If you have questions, we're going to have time at the end, but please put them in the chat and we'll get to them at the end of the webinar. It's my pleasure to introduce Dr. Sarah Henderson. Sarah is Scientific Director in Environmental Health Services at the British Columbia Centre for Disease Control. She's also Associate Professor in the UBC School of Population and Public Health, where she leads a program of applied research and surveillance to support evidence-based policy for the province. This role requires her to be a generalist rather than a specialist. Her work spans a very wide range of topics, including air pollution from all provincially relevant sources, which includes wildfire smoke, residential wood smoke, industry, road dust, shipping, and vehicles. Her work also includes extreme weather events, radon gas, food safety, water quality, and exposures managed by the Drug and Poison Information Center. All of her work integrates large environmental data sets with large human health data sets from multiple sources, and she views data science as a key competency in environmental health. We at CNU are especially grateful to Sarah because she's helped to lead efforts to help us make smoke exposure data available on the CNU data portal, which is all publicly available to researchers at canudata.ca. That's CANUE data.ca. And so I think it's clear why we're very excited to have Sarah come and speak to us today. So I'm very pleased and excited to welcome Sarah to speak to us about forest fires and the built environment. Welcome, Sarah.
Yeah, good morning, everybody. I guess I'll just go ahead and share my screen here and we can get started. Nice to see some familiar faces in the crowd and also see some names I don't know, which is fantastic. I want to start by saying I am coming to you from the traditional territory of the Stolo people, Hul'qumi'num speaking people in the beautiful Fraser Valley of British Columbia. I'm at my home in Mission today. And I changed the title of this talk a little bit, but it's going to go along the same lines: extreme heat, wildfire smoke, the built environment, and public health. And I really set this up as a narrative. I have almost no words on my slides at all, but these are topics that are very near and dear to my heart, and I want to just kind of talk you through them from my perspective. So a little bit of history on extreme hot weather in British Columbia, and then wildfires and smoke in BC, how the indoor environment plays a role in that, how the built environment in general plays a role of that. And then I want to really focus on the summer of 2021, the heat dome that affected our region was unprecedented and alarming and indicative of the type of thing we need to continue to prepare for as the climate changes. So we had this hot weather event back in 2009, and it really largely affected the lower mainland area or the greater Vancouver area. And what we found was that over the course of about a 7-day period, we had 110 excess deaths associated with these relatively high temperatures. And when I say relatively high, I want to be clear that relative is important, because the temperatures we were recording at Vancouver International Airport were about 34 degrees. That is not hot by international standards. Lots of people live in temperatures that are 34 degrees day in and day out. But when a region has a typical summertime high of around 22 degrees, 34 degrees is quite hot. And it is quite hot when the majority of the population does not have air conditioning or any type of mechanical temperature control in their homes. And because of this, we we saw a significant impact of the event, about a 40% increase in mortality on a 1-week basis. And we found through our subsequent research a few patterns that are quite typical of mortality during extreme hot weather, with the exception of this first one. When we looked at the impact of age, there's, the perception that the most elderly are most at risk during these events. And we found something quite different in Vancouver. We found, sort of younger seniors were most at risk, those in the 65 to 74 age category. And we didn't have really good data to investigate this at the time, but we hypothesized that this group had been at higher risk, probably due to significant comorbidities in that age range, potentially due to social isolation. And it was something we flagged for further research. We also found a lot of people died out of care, not in hospitals or long-term care facilities. That is a hallmark of extreme hot weather events. Mortality was increased in more densely populated areas and more low-income areas. So this was our first pass with some pretty crude data, but we could already see patterns that were of importance. We then developed some statistical methods to try to tease apart people who had died because it was hot and people who had died because they were expected to die anyway. And this is one of the really challenging things that happens when we have these kind of mass casualty events related to extreme hot weather, is we don't typically see those deaths as being coded as due to extreme hot weather. They are coded as being due to cardiovascular events or respiratory events or whatever the attending physician or coroner decided was the cause of death. So we don't have a really easy way to tell who died because they were going to die that day anyway, and who died simply because it was hot outside. And the statistical methods we developed helped us tease those two apart. And we came down to a group of 73 of the 110 deaths that we felt pretty confident were probably caused by the heat. And I just want to highlight some differences in these deaths compared with what we would say normal or usual summertime deaths. So a lot of them in this kind of younger category compared with this being more normal. A lot of them at home in an in-home environment or another environment compared with sort of hospital and long-term care. And then the one that's most striking and where we've focused a lot of attention since then is related to deprivation. And here we use the Vancouver Deprivation Index. I'm going to talk to you later about another deprivation index. But what we found is, the majority of these 73 deaths were in that highest deprivation category. Whereas we look at normal deaths, they are quite evenly distributed amongst the quintiles of the category. A few other things, when we looked at population density, we definitely found it was in areas of higher population density, whereas again, the usual deaths are pretty evenly distributed. And then looking at cause of death, we didn't see really big shifts, a little bit of a downward shift related to cancer, cardiovascular outcomes, and respiratory outcomes. But the big upward shift that we were most concerned about was external causes of death. And what we saw was multiple accidental pharmaceutical poisonings, overdose due to illicit drugs, and an intentional self-harm. So in this 1 week period, we had 7 suicides, where we would typically have 1 suicide in a week in the region. So some concerning sociodemographic patterns in these data. This got us more interested in, well, how big of a problem is extreme hot weather in British Columbia? Because until that 2009 event, it was a non-issue. We have a temperate climate here. As I said, the typical summertime temperature is about 22 degrees. Typical winter temperature is about 4 degrees. We just don't have big swings in climate, and that's because most of the population lives in the coastal region where the temperature is moderated by the Pacific influence. And then we do have some areas where the temperatures are more extreme, the dry plateau that sits between the coastal and Rocky Mountain ranges. It gets quite hot in the summer. It's a region that's quite well adapted to those hot, dry temperatures. And there's some places that get colder as well. So we just kind of split up the province into what we defined as different ecological regions to look at this temperature mortality relationship. And the two kind of key features we were looking at is the temperature at which we start to see a mortality effect in warmer weather, and the slope of this line. This dashed line here just shows the increase in risk at 30 degrees across all of the regions. So this is the coastal region where Vancouver and Victoria sit. This is where we have the steepest inflection, or the steepest slope of the relationship. And really, we start to see an increase in temperature-related mortality above about 18 degrees. In that dry plateau region, we don't see a strong slope. The population doesn't start to respond until about 23 degrees. The mountain region, also not a strong slope, not surprising. This nadir point is a lower temperature, and in the north again, which is a not very highly populated area, that's why the confidence intervals are so wide. But just getting some sense of the way that temperature impacts the population across the province. Now, the key feature I need to point out to you here is where these plots stop. So in this region, our maximum temperature is about 34 degrees. And this region, we're coming up to about 38. Here we're down around 33, and here we're down around 33. Those are the maximum temperatures that have been observed in these regions. These are parent temperatures, so a combination of air temperature and humidity in the data that were included in these analyses, which went up from, I believe, 1998 to 2004. No, sorry, 1998 to 2014. So years and years of data. I'm going to switch now to talk about the history of wildfire and smoke in the province. This is a time series of area burned over quite a long period. I started studying the health effects of wildfire smoke in BC in 2003, which is right here. For those of you who remember 2003, it was a devastating wildfire season. We had a significant interface fire in the community of Kelowna. There were hundreds of houses burned, and Okanagan Mountain Park was razed, essentially. There was a lot of smoke in the interior region associated with this fire. And you can see that we hadn't had a season of that magnitude for quite a long time in the province. So this was a record-setting, devastating wildfire season. There were reports, and it was considered somewhat unprecedented at the time. The following year, we had another big area burned, but not as much disruption in the province. And then I just want you to look at the pattern since then. We're up to 2019 here. That's 2019. We have, this just increasing pattern of increasing wildfire until we hit 2017, which blows everything before it out of the water. This was, again, another incredibly disruptive wildfire season. We had the town of Williams Lake evacuated. We had, over the course of the summer, there were 65,000 people evacuated at different times because of the risk to communities from these wildfires. And I think when the 2017 season ended, there was sort of a communal provincial sigh of relief, because that can't happen again, right? And then it happened again the next year. 2018 season didn't cause quite as much disruption. There wasn't as much interface fire, but there was fire all through the province, and it was actually a significantly smokier summer than it was in 2017. We had days upon days where the whole province was just covered in wildfire smoke. So, whenever I think about climatic changes and severe events associated with climatic changes, this is the example I go to, because we'll get to the heat dome of 2021 later, and I think there's a collective belief and hope that that's not going to happen again in 2022. But this is the example I point to every time we have that kind of magical thinking, is it definitely can't happen again in 2022. We hope it doesn't, but we have to expect it will. So Alan mentioned that we have made some wildfire smoke estimates available through Canoe, and those come from a model called the Optimized Statistical Smoke Exposure Model, or ASSEM. This is estimates from ASSEM for August 2018 across the whole province. We have these types of estimates daily. Those aren't on Canoe. It's a huge data set. Currently the monthly and seasonal, I believe, and annual estimates are up there. But we really wanted to put forward data on wildfire smoke that those who are interested in this exposure can work with. And you can see what ASSEM does is it makes estimates in all populated areas of British Columbia, whether or not there's monitoring equipment there. And, you know, there are monitors in lots of places here, but we're able to make these estimates through a much broader range. So August 2018, we have down here the Lower Mainland and Victoria regions. Their average over the course of the month about 25 micrograms per meter cubed of PM 2.5. We were under air quality advisory for almost 22 days, or for 22 days in the summer of 2018 in the region. Most of them were in August. So, you know, that was considered really, really bad air quality in the Lower Mainland. And in comparison, I just want you to be clear of what's happening with air quality when it's really, really smoky in a highly populated area and a lot of people notice. This is what's happening in the more rural and mountainous regions of the province. Incredibly high average concentrations, 100 micrograms per meter cubed over the course of this month. So we're talking quite extreme and prolonged smoke exposures. I'm just going to show that to you in another way. Here we have 5 years of population weighted daily PM 2.5 estimates over the course of the summer. 2016 and 2019 were both quite mild wildfire seasons. 2017 was not. Here's how it looked in Vancouver. 2018 was not. Here's how it looked in Vancouver. And then in 2020, we had this long-range transport of wildfire smoke into the region from fires that were burning in neighboring states in the US. And important to note that the impacts of an event like that can be just as significant as the impacts of events that are due to fires that are actually burning in British Columbia. Smoke does not know any boundaries. This is how one of those smoky days in August of 2020 looked, just to give you a sense of what a really smoky day looks like in a city if you're not in a place that is routinely affected by these events. It's pretty bad, right? This is how things looked in Kamloops over these 5 years. So in comparison, the 2020 impacts in Kamloops were pretty similar to the 2020 impacts in Vancouver. We have the same duration, approximately the same magnitude. This is what the smoke looked like in this population that is not small, in 2017 and 2018. So very high daily concentrations, very long periods of prolonged high exposure. And here's 2018. In comparison, this is Prince George over those years. So in 2017, Kamloops got a lot of smoke. In 2018, Prince George got a lot of smoke, but it wasn't as impacted in 2017 or by that 2020 event because it's significantly further north in that long range transport. I really just want to paint a picture here for you of what these exposures look like, how variable they are from day to day, how extreme they can be from day to day, and how variable they are across the types of populations that are exposed. We have done a great deal of work on the short-term health effects of smoke exposures in British Columbia, and this is simply a summary of it. On the left-hand side, we are talking about respiratory outcomes. On the right-hand side, we're talking about cardiovascular outcomes. And all of these outcomes are the percent increase associated with a smoky day, where we define a smoky day as 100 micrograms per meter cubed. You've seen from those plots that these are typical concentrations on days that are quite smoke impacted in the province. The number one conclusion is that respiratory events are more strongly associated with the PM2.5 and smoke exposure than cardiovascular events. You can see that we have significant increases in all of these outcomes, including respiratory mortality, though the confidence intervals are quite wide, and COPD. The interesting thing about the mortality is what we do see quite clearly is individuals die in their homes of respiratory mortality. So indicative that there is a rapid and dangerous response to these smoke exposures for some very susceptible people. Otherwise, we're looking at dispensations of Ventolin, and respiratory physician visits for asthma, COPD, ear infections, lower respiratory infections, all of them are increased. When we look at the cardiovascular side, we do see effects, but they are small in comparison. These are more consistent with the types of effects that we would see for PM2.5 in the urban environment from different sources. These are much larger than what we would expect to see, and it's kind of a hallmark of wildfire smoke that these respiratory outcomes tend to be quite a bit more elevated than they would be if the PM2.5 was derived from other sources. We're not sure why that is, but my suspicion is that it's driven by the co-pollutants. Wildfire smoke is a very complex mixture of gases and particles. We tend to use PM2.5 as a proxy for the entirety of the mixture, but it probably isn't just the PM2.5 that is driving these impacts. This is the work of my PhD student, Angela Yao, and what we wanted to do here was dig down into that sub-daily question. So as I said earlier, we find that the respiratory mortality associated with wildfire smoke can happen very quickly. People die in their homes, they don't make it into care, which indicates that the response can be quite rapid. So we wanted to look at the response hourly rather than daily. And that's what Angela's done here using ambulance dispatch data. Ambulance data are fantastic because we have the time at which the ambulance was dispatched and the exact location to which it was dispatched. So that information gives you what you need to do these types of analyses. And here, this is reports of breathing problems and ambulances dispatched to them. We see that the effect of the smoke starts immediately. And these are hospital diagnoses for ischemic heart disease. And again, we see that the effect starts immediately. So these aren't big effects, but the shape indicates that the effect is immediate and it reduces over hours of exposure. And then when we accumulate those effects, they are significant in this case and sort of borderline in this case. A question we are grappling with, and this is work in progress, we're not finalizing it yet, is what happens after an extreme season? We've had these populations exposed to this heavy, long, smoky periods. Does that affect their health in the year following the season? Does it knock down the health of the population? We would sort of expect it to, but it's not something that's well understood. So these are interrupted time series models looking at all uses of respiratory services. Actually, this is COPD specific services in a cohort of individuals that was exposed in the interior compared with a cohort that was exposed on Vancouver Island, and looking at what happened after that 2017 wildfire season. So the blue line shows what the model would show if the time series were not interrupted, and the red line shows with the time series interrupted. And with these models, we do see, a step change after that wildfire season in these visits and billings for COPD. Again, this is work in progress. I'm not entirely confident in these results because we are finding that the models are very sensitive to the choices we make around modeling the temporal trends in the data. But it is indicative of the type of thing that we're seeing, where yes, we do see these small changes in the health of the entire population after these extreme seasons. Well, now I'm going to move into talking about the indoor environment and how it relates to these exposures. Oh, I see. That's what I wanted. I skipped over it. Most of us spend the vast majority of our time inside. It's kind of sad. This is an old study now, but I really doubt that things have changed much in recent years, especially with COVID. And it estimates that of the time spent among Canadians and Americans, we're indoors or in a car for, 94, 93, let's just say over 90% of our time, and we're outdoors less than 10% of the time. So either everyone is experiencing all of these effects that we associate with outdoor exposures because we only have outdoor measurements for temperature and PM 2.5, we're always modeling or using what has happened outdoors. They're either experiencing these effects in the less than 10% of the time they spend outdoors, or they're experiencing them indoors. And we are not doing a great job of making that outdoor to indoor transition in the way that we model these exposures. And that's definitely what's happening here. So you just need to be really cognizant that when we're talking about ambient exposures and their effects on population health, they're not affecting the population in the ambient environment most of the time, they're affecting them in the indoor environment. And there's a transition that occurs between the outdoor exposure and the indoor exposure that has significant impacts on the way they affect the population. So for smoke, it really, really depends what kind of building you're in and how it operates. These are data collected by my colleague Prabjeet Barn, again, quite a long time ago now, but a lot of other studies have shown very similar types of results. And this is during wildfire season when it's smoky outside, looking at the infiltration of PM 2.5 from the outdoor environment into the indoor environment over a series of homes. The black bar shows that infiltration across these homes when there is no filter or air cleaning running in the home. And again, you just see that this is highly variable. So in this house, we have 100% infiltration. It's just as smoky inside as it is outside. And in this home, we've got about 30% infiltration. It's significantly less smoky inside than it is outside. The gray bars show what happens in these homes or what happened when air cleaning was used. This one came way down, this one came way down, this one stayed about the same. This one didn't change too much. So we have these opportunities to intervene in the indoor environment, and we have understanding that the indoor environment and how it reflects the outdoor environment is highly variable. And this is really just going to happen as things stand right now on a building by building basis. So it's very challenging to understand what an individual's exposure may be at a location if you don't know anything very useful about the kind of building that they were enveloped by when that exposure was occurring. This is more recent work from our team at the BC CDC in collaboration with UBC and Vancouver Coastal Health, where we were quite concerned about what's happening in healthcare facilities when it gets smoky. You have a large and potentially susceptible population all in the same place, and it's important to understand what the air quality impacts of these events are. So this is an inpatient rehabilitation facility in an older building. This is capturing that 2020 smoke event that was long-range transport from US states. On the top, we show what the low-cost sensor is measuring on the rooftop. And then we have a few of the 7 indoor locations shown below. And the key things to point out here is that smoke gets into the building immediately. So we have this little peak here. It is reflected in all of the locations. Concentrations go down a bit and then they swing back up again. As soon as they swing back up, we see that in all of the indoor locations. We do see that the concentrations are attenuated by the indoor environment, but they are not low. So even though we're not having complete infiltration of this smoke into this building, we are looking at periods where the indoor concentrations are 50, 60, 70 micrograms per liter cube. That is not good air quality by Canadian air quality standards. So there is protection being offered by the building, but it is not offering good indoor air quality. So that's sort of the indoor environment and smoke. We're up against the wall when it comes to wildfire in Western North America. There's all kinds of things that we need to consider about the wildland-urban interface and the risk associated with it, but there's not much that we can do in the way that we create the built environment that is going to change the fundamental wildfire risk, which is related to wildlands and the interface. We are just in a situation where we have used fire suppression for decades without necessarily recognizing the damage that that was doing to the natural fire regime in the environment. So we have this high fuel load on the landscape across the region, and that high fuel load is now intersecting with a rapidly changing climate that facilitates fire by drought, by temperature, higher temperatures, and by higher winds. So this very kind of dangerous intersection of management policy over decades and climate change coming together. So we can't do much about the way we build the environment to reduce people's smoke exposures. What we do have to do is focus on indoor air. And I just want to read this to you because I love it. And I think it reflects the reckoning that we are going to have societally around indoor air quality related to COVID-19. So the COVID-19 pandemic has revealed how unprepared the world was to respond to it, despite the knowledge gained from past pandemics. A paradigm shift is needed on the scale that occurred when Chadwick's sanitary report in 1842 led the British government to encourage cities to organize clean water supplies and centralized sewage systems. In the 21st century, we need to establish the foundations to ensure that the air in our buildings is clean with a substantially reduced pathogen count, and I'm going to add and PM 2.5 concentration in there, contributing to the building occupants' health, just as we expect the water coming out of our taps. And this will take years, but I think a lot of people are thinking about COVID and aerosol transmission and indoor air quality in this light. And I just want to advocate for the fact that we need to think about air pollution and particularly smoke pollution when we're having those types of conversations. Things are a little different when it comes to the built environment for heat. We definitely know that the way we build can affect the heat exposure that people experience. I'm going to say this now, and I also want to say it again later. I think there's a little bit too much over-reliance on the urban heat island effect to explain the health impacts of heat when they occur. What we are seeing over and over again is an intersection between the urban heat island and susceptibility to heat. And we cannot think about the urban heat island alone. Again, I'm going to say more about that when I get into the 2021 heat dome. But I do want to point out what I think is the most important feature of the urban environment, which is surrounding greenness. This is some work we did a while ago where I had a student out walking around with a thermometer to measure very small scale changes in urban temperature. And then I had him wearing a GoPro camera on his shoulder. Another student took the data from that GoPro camera and sort of broke it down by color and took out all the green and yellow and left kind of the gray and other colors. And we were able to classify every frame in this video data by its percentage of green and yellow pixels. Then we can take those data from that video capture and compare them with the temperature data that were being simultaneously measured. And this is just a few examples of really strong results that we saw on different routes. So here's the student walking along on this route. We see a very strong temperature gradient between this part of the route and this park part of the route. And we see this very strong, dark green in this region, where things are cooler, and lighter green out here, especially along this major road where things are hotter. This is just the Z scores compared with each other. So when the Z scores for heat are high, the Z scores for greenness are low, and vice versa. This is another route, slightly different sort of pattern, but here we see this cool temperature kind of all the way along this middle boulevard here, and we see pretty green area along there as well. So these aren't perfect correlations, but they are indicative that at a small scale, greenness does matter. Back to the 2009 hot weather event. We did look at this among the individuals who died in the Lower Mainland. And when we look at residential greenness and compare it across years, I don't know, sorry, I'm not explaining this well. When we look at residential greenness in a case crossover design, we can see we have this strong impact that increases with increasing greenness. So if the greenness is high, there's lots of greenness around, that's the reference category. If the lowest category, we're seeing almost a 4% increase in risk of mortality during this event. Even in this moderate high category, a twofold increase in risk during this event. So further indication that greenness sort of at the time of death is associated with protection. Okay, let's get into the 2021 heat dome. Most intense on record, unprecedented event, the Omega block, which sounds way cooler than it was, honestly, if you were in the region and experiencing this. Something that was known could happen. I don't think anybody who studies climate and weather expected this type of event at this point in the changing climate in Canada and the US. So it kind of came at us in an unexpected way. And really, in terms of the temperatures that were measured, so far beyond what is normally experienced in the region. So this is the This is satellite data showing the temperature at 2 meters in the column, and then anomaly from typical. So the anomaly from typical throughout most of British Columbia is 10 to 15 degrees. That's a lot of temperature. You can see how unusual this was for the region. I now refer to Lytton as the grim poster child of climate change. There was much hoopla around this 3-day set of national temperature records. So the national record for measured high was broken on the 27th in Lytton, again on the 28th, and again on the 29th. There's 3 degrees difference between the 27th and the 29th. And I want to highlight this because national record hat trick, like go Lytton. There was so much, I guess, enthusiasm in some ways for the fact that we were breaking all of these temperature records. I don't think that the way that this was put forward in the media really caught the gravitas of the situation. And then on June 30th, I don't think we know exactly what happened, but the assumption is that a spark got thrown from a train and the town burned down because it was so hot and dry. So that's what climate change looks like in British Columbia. I just sort of added a bar here for the wildfire season that's really started just after this heat dome ended and continued throughout the rest of the summer. It was another very hectic season. It was largely contained to the central interior of the province. It wasn't as extreme as those 2 prior seasons that we've talked about, but it was pretty extreme still compared with what has been normal over past decades in BC. From a smoke perspective, it was interesting in that we had a lot of wind and we did certainly see smoke. There's no doubt, but it was quite transient compared with what we've seen in prior years. So we'd have a few days of smoke, the atmosphere would clear out, we'd have a few more days of smoke, the atmosphere would clear out. But standing back from BC, just want to look at this picture of all of North America on, one of these days that was smoky in 2021. And this is wildfire smoke everywhere. It's just everywhere. So fires that are burning largely in the Western US are causing significant air pollution across the entire continent. And we've seen this summer after summer after summer. We're going to keep seeing it summer after summer after summer. We are moving into a world where wildfire smoke is starting to dominate lifetime exposure to air pollution. We've controlled emissions from vehicles, we've controlled emissions from industry, and this is what we're going to see now. This is really where our attention needs to focus. Okay, let's get into the mortality associated with this event. On the top, we have population weighted temperatures for the entire population. On the bottom, we have daily deaths. Very clear impact of this event. You can see the temperatures start to build, the deaths follow by about a day. We'll talk about that a little bit more in a second. We estimate 740 excess deaths in BC associated with the event. Somewhat different from what you've likely heard in the news. The coroners have said 570. It's important to understand that not all deaths are reported to the coroners. So they only investigate the deaths that have been reported to them. If a death is not reported, they don't know what's happened and they do not have an opportunity to state whether or not it was heat related. So not surprising that there's a bit of discordance there. Overall, a huge impact. This is a 100% increase in mortality over the course of 1 week. And on this particular day here, a significant, almost tripling of mortality that we would expect. When we look at this by age, again, I want to point out that it's not the most elderly that are most or affected by this. So We do see an impact in those less than 50, but in every age category over 50, we see 100% increase in mortality. This is not a problem that is restricted to the most elderly people. It's more likely to be a problem that is concentrated among those people who have chronic conditions and who are socially isolated and cannot react to protect themselves in this weather. When we look at it across the province, we certainly see some differences in patterns. This is the Fraser Health region, which is most of which is in Greater Vancouver. In the interior, we see an impact, and then we see this sustained impact. Now, remember, it's also really smoky and a lot of fires going on here. So folks in this region are living in really complex environmental conditions all summer. Northern, where there's a small population and it didn't get as hot, still an impact. Vancouver region and Vancouver Island. So the impacts are seen right across the province. It wasn't like 2009 where we only saw them in Greater Vancouver. And then this. So this is where people died in the community versus long-term care facilities versus acute care. And I think this is the most striking plot of everything. People died in their homes or in other people's homes, but they died indoors in the community. There were impacts in long-term care. This is obviously COVID-related impacts in long-term care. And then in acute care, there were immediate impacts. And then we continue to see that effect for another couple of weeks. This is probably the most important plot I'm going to show you today. This is indoor temperatures in a home with air conditioning, the blue line, and a home without air conditioning, the red line, and outdoor temperatures measured in Abbotsford, which is in the Fraser Valley, not far from where I'm currently sitting, sort of in that transition zone between the hot interior plateau and the coastal region. So this is what was happening with outdoor temperatures during the heat dome. You live in this house, you're pretty comfortable. You live in this house, it's almost 40 degrees in your house by the time the evening of June 29th rolls around. And note, this peak temperature occurs multiple hours after the outdoor peak temperature. When it cools down in your house overnight, it cools down to 33 degrees. When it cools down outside overnight, it cools down to almost 20 degrees. So houses trap heat. And that's why people die. People don't die because it's hot outside, they die because it's hot inside their houses. When we look at the deaths that occurred in the community in the Lower Mainland region, we see some patterns that are very similar to what we had seen before. And this is really where I want to call out again that question of deprivation. So in this case, we're using a different deprivation index, and we're using a combined index of material and social privilege. So here, as the reference category, we have those who are in sort of the average group. Up here, we have those who are both materially and socially privileged, not at risk. When we look at materially privileged but socially deprived, we see there's still risk associated with social deprivation, higher risk associated with material deprivation. And then again, for those who are in both categories, a much higher risk, a threefold increase in odds of mortality. And then, so these are the crude models, and these are fully adjusted model. We do see when we look at sort of these indicators of the built environment, greenness within 100 meters, building footprints within a kilometer, distance to a major road, distance from a large body of water, they are all significant in the crude models. When we look at the fully adjusted model, which includes this really important information about deprivation, it is only greenness that remains. Surrounding greenness is an important protective factor. I'm almost done here. This has really brought me back to some work that we did following the 2009 event. This is the Heat Exposure Integrated Deprivation Index that we created after that event, because we recognize that it's not just about heat exposure, it's about this intersection of heat exposure and sociodemographic factors associated with susceptibility to those exposures. And we looked at different ways of building an index based on a group of 4 variables. One of the variables was related to sort of the underlying temperature exposure modeled across the region. One of the variables was related to the Vancouver Deprivation Index. One was related to the road network, and one was related to the number of seniors living alone in the region. And we built the index in an unweighted way, simply adding these variables together. We built it in a weighted way, where we weighted the variables according to the effect that we were seeing in the models that the variables were having. And then we stacked them in the way we used to build Heidi. And I don't want to go into the statistics of that process, but we really wanted to do this to show when you look at the variables in a certain way, how much more distributed the risk becomes. So, here, when we're simply adding the variables up, we have these kind of small pockets of risk. And these are very high risk areas. We saw it again in 2009, the downtown east side, this corridor along Highway 1A in Burnaby, New Westminster, which sits on a south-facing bare hill, and in Abbotsford. But when we start expanding out the way we use these variables, we see that risk is much more distributed, and that's actually what we observed in 2021. People died everywhere. There were pockets of concentration, but it was spread all across the city. So there's been a lot of talk about this in the last couple of days because of this Human Rights Watch report. And I think they did a fantastic job of going out there and talking to people, those who are going to be susceptible to death during these events. But the International Human Rights Organization says that the BC and federal governments failed to protect seniors and people with disabilities. And sorry, I get a bit emotional about this event. It's everybody's responsibility to protect these people. It's not just the government. We need to build protections around the people who are susceptible to these events so that we don't see this mass casualty in future when these events occur. The provincial government can't do that. The federal government can't do that. Only us working together can do that. And it means individuals building their networks, families building protections, communities building protections. It is such a nested approach that we're going to have to take to ensure that we can protect people from these types of events in the future. And this is a piece that we wrote last year that has been, really sticking with me recently, which is social connection as a public health adaptation to extreme heat events. We don't have the coroner's report yet. I feel like I can almost guarantee you it is going to be over and over again the case of socially isolated individuals who had significant comorbidities died in their extremely hot homes. We're just going to hear that story over and over again. So how do we tackle those things so that this doesn't happen? The role of public health is part of it for sure. And, my push is always related to preparedness. We cannot go into next summer hoping that we don't have Heat Dome 2022. That's not the strategy that's going to work. We must go into next summer expecting that Heat Dome 2022 is going to happen, and it's going to be possibly even hotter than Heat Dome 2021. That's the only way that we can actually get the systems and policies and practices in place that are going to make a difference. So thank you very much. I hope I have left a little bit of time for questions, not as much as I intended to, I'm sorry. And yeah, thank you for coming out.
Thank you, Sarah. That was very packed with lots of information, which I think and we have lots of questions. If people want to turn on their videos, you can go ahead and do that now. I'll just start asking a couple of questions. Jeff Brook, the scientific director of Canoe, asked if you could comment on the protective nature of surrounding greenness and its potential to be greater in neighborhoods of greater privilege, i.e. disentangling the socioeconomic status and greenness access influences on heat susceptibility.
So I mean, these things are almost impossible to disentangle, but I do want to point out again, like what we found in our models is even when we're adjusting for deprivation, greenness remains protective. So my interpretation of that is if you live in a deprived neighborhood, greenness is protective there. If you live in a privileged neighborhood, greenness is protective there. What we need to do is really, really push the value of greenness in these more deprived neighborhoods where there is simply less of it. And that, I think, is, you know, a place where city planning and policy can really come into play. Greenness is great no matter where it is, it's fantastic, but we really, really need to emphasize the importance of these green spaces in those places where people can garner even more protection from it.
And Alon is curious about the mortality temperature relationships. If you could comment on the modeling, whether they were modeled using the lag linear or non-linear model, and go into a bit more detail about the time period.
I've talked about a lot of different temperature mortality relationships here. In many of the analyses I presented, we're simply comparing people who died during a hot period with people who died during more normal summer temperatures. So we're not actually accounting for temperature in these analyses. When I was talking about the 4 ecological regions in British Columbia, that was a distributed lag nonlinear model. And the lag on that model was 4 days.
On the significantly higher risk related to heat in the highest deprivation strata in Vancouver, were you able to tease out why we see this discrepancy between low versus high deprivation? Lower ability to adapt, existing comorbidities?
Oh, all of those things. So lack of access to air conditioning, lower quality housing, more likely. You know, you live in an apartment, not someplace with a basement that has a cool place to go. Significant, you know, we know that lifelong health is associated with these things, so more significant comorbidity, all of those things stack together into, you know, a confluence of susceptibility and risk.
Okay. And one question on public health messaging. Eleanor says she worked on some unusual heat metrics for Canoe and used temperature relative to local normal distribution, which highlighted the issues in coastal BC, but because the metric did not show Montreal or Winnipeg as the top issue areas, since they're normally very hot, people didn't understand the metric or thought it was wrong. So what are your thoughts on the, you know, best measures for public health messaging around this?
So one of the frustrations in Vancouver is what, you know, they report temperatures at Vancouver International Airport, which is sitting right on the water, there's coastal breeze all around it. It is not reflective of what most people in Vancouver experience. So we find that in this region, talking about difference between what's reported at that airport station can be useful. I don't think there's a perfect answer to this. We also, you know, there's constantly the tension between air temperature and humidex or other indicators of apparent temperature, and, you know, what makes most sense. And it's just kind of super regional, because we don't, if it's hot here, it's generally not humid, so the humidex doesn't kind of play into things. In other places where it's hot, it's really humid. So I don't have a solid answer for how we should be communicating about this, you know, nationally. I think it is a regional question.
And do you have any thoughts on how weather warnings or advisories could be updated to better reflect heat risks?
Do we have another hour? Yeah, so what we will drive towards in British Columbia over the next months is a two-tiered system where we use the established heat warning criteria, which was, a very large project between Environment Canada and contributing public health agencies across the nation, as the sort of first level. Like, yeah, it's going to be pretty hot, and we need to add onto that an emergency heat indicator in partnership with Environment Canada, so that when we have these conditions where we are likely to see significant excess mortality associated with the hot weather, there is some mechanism by which to say this is an emergency and to treat it as an emergency. When 750 people die in a week, it's an emergency. So we really need to kind of work towards talking about these heat events as the public and public health emergencies that they are.
I'm cognizant of time. It's 1 o'clock now. Do you have time for one more question? Or
I do, if other folks want to hang around. Yeah, I think I do anyway.
Just a question about Victoria. During the heat dome, there were no cooling centers publicized at all, either on the city site. So there was nowhere identified for residents to go and hang out for even a few hours. So wondering if you could comment on the role for local government to respond to these kind of extreme heat events.
Yeah, so it's that circles within circles within circles, right? So it's the health authorities working with the local governments to help the local governments develop heat plans that are embedded and consistent within the health authority heat plans. It's really, the ideal state is that there is an emergency warning issued by Environment Canada, and everybody pulls out their emergency heat plan and enacts it. That means, as an individual, I pull out my emergency heat plan and enact it. My family pulls out its emergency heat plan and enacts it. The community, the municipality, the health authority, because everybody has that emergency heat plan. And I like to make this analogous to the COVID plan. We required, and I think this is true nationally, that if you wanted to be open during COVID, you needed to have a COVID plan to show to the health authority that you had thought about this, that you had protections in place. So, everybody needs that emergency heat plan, and everybody's got to enact it when the emergency alert is issued. That takes years to build, but I think that's where we need to go.
Okay. I think we'll have to end it there. I'd just like to take this opportunity to thank you again very much for coming and speaking with us today, and thanks to everyone who's joined us on the call.